is Diagnosis Glaucoma with your hosts, Dr. Mona Kaleem
and Dr. Harry Quigley.
Hello, welcome to Diagnosis Glaucoma. Today we are going to talk about glaucoma surgery, specifically the type of surgery that takes place in a part of the eye called the conjunctiva or the subconjunctival space. And to be part of this discussion, we have a special guest, Dr. Reena Garg. Reena, can you please tell us a little bit more about yourself?
Absolutely. Thank you so much for having me today on the podcast. I'm excited to be here. My name is Dr. Reena Garg. I'm a glaucoma specialist. I practice in Rockville, Maryland, and I also work with the residents at Georgetown University.
That's a difficult combination that you have. Not only are you a surgeon and a clinician, but you're an educator. So thank you very much for everything that you do.
Absolutely. Thank you. I know that you know that well too, being an educator yourself. So thank you.
Thanks. Well, it's great to have you on again. And we just want to know what made you want to become a glaucoma specialist.
Yeah, absolutely. I never thought I would go into glaucoma, going to residency. I really liked kind of comprehensive ophthalmology. I enjoyed cataract surgery, and I was open to a lot of different fields. But the one thing that struck me about glaucoma was the relationships you form with patients. It was the one subspecialty that I noticed that the patients got to know their glaucoma doctor very well. They saw them several times a year. And it felt really important to be a part of the patient's life, not just, as a doctor, but also as a friend and getting to know the patients and their lives and the things that they're facing. And then, of course, glaucoma having such a big impact on public health and on the world, being the leading cause of irreversible blindness, it felt like it was something that not only could you form meaningful relationships, but you could also make an impact. And that really appealed to me.
And within glaucoma, do you have a specific interest?
That's a great question. I've never thought about that. I don't think I particularly do. I think I lean more towards surgical management of glaucoma in terms of thinking about patients' lifestyle and quality of life. I find myself having particularly conversations with patients, not just about their glaucoma, but also about how their glaucoma is impacting their life. And, my career is kind of headed in that direction where I want to make, more connections for people outside of just treating their eye pressure, but also helping them in their day-to-day lives and things that may affect them in terms of their vision.
And what kinds of surgery do you do? Are there specific ones that you do, or just kind of tell us about what your surgical specialty is?
Yeah, absolutely. So I do all kinds of glaucoma surgery. I trained many years ago, more years than I care to admit, when there were only, 2, maybe 3 different types of glaucoma surgery: trabeculectomy, tube shunt, and the first minimally invasive glaucoma surgery called iStent had come out in the market during my fellowship. And it's really exciting because even though I've been practicing for so long, I feel like I'm always learning because there are always new procedures coming out, new techniques. And so I do a lot of the minimally invasive techniques in addition to doing the more traditional gold standard surgeries like the trabeculectomy or the tube shunt surgery. And I'm always looking to learn and provide new things for my patients, because I think in glaucoma we're lucky because there's always new opportunities to help our patients and to help prevent them from losing any vision.
And for the listeners, just to go over the anatomy again, the conjunctiva is that translucent layer of the eye. So when you look at someone's eye, you see the whites, and it's basically that layer. And so when we do conjunctival or subconjunctival surgery, we dissect that upper translucent layer and we do the surgery right underneath of that. So as Dr. Garg just said, the trabeculectomy is amongst the gold standard glaucoma surgeries, particularly in the subconjunctival space. So many patients have a trabeculectomy. Now we have these minimally invasive surgeries, so there are more options. And Dr. Garg, you are actually known for your work with a particular type of subconjunctival surgery. It's called the XEN Stent. Can you tell us a little bit more about that?
Yeah, absolutely. So the XEN Stent is kind of a little bit in the same category as trabeculectomy and tube shunt. It doesn't quite have the same effect as those two surgeries, but the science behind it is very similar. The thought is that when we do that type of surgery, we've decided that the natural drain of the eye isn't working. And so as glaucoma specialists, we've decided, well, okay, if the natural drain isn't working, we need to find another way for the fluid to come out of the eye. And traditionally, the most common, the first surgery that we really ever did in that way was called a trabeculectomy, where we use the patient's own tissues to create a hole in the natural drain to allow the fluid to drain out of the eye and collect under that, exactly what you said, that thin, clear covering of the eye called the conjunctiva. And that's called a bleb. And as that sort of evolved, we had something called a tube shunt, where instead of creating a bleb out of your own tissues, we would put in a device in the eye that would drain fluid kind of under the bone of the eye that surrounds the eye and into a reservoir, and that would create a bleb a little bit farther back behind the eye. And then more recently, in the past 10 years or so, there's something called the XEN Stent. So this is a micro-invasive or a small stent. It's about 450 microns, and it basically sits in the natural drain called the trabecular meshwork, and it drains the fluid from inside the eye to the subconjunctival space to create that bleb. The science is very similar because the goal is to bypass the natural drain and lower the pressure and create that little reservoir of fluid or the bleb. It's different because you're not using the body's tissue and the opening is much smaller. So it doesn't always have the same effect as the other surgeries, but the science is very similar.
You mentioned the word bleb. Can you just tell the audience what a bleb is?
Absolutely. A bleb is basically a collection of fluid under the clear covering of the eye. As Dr. Kaleem mentioned earlier in our talk, you look at the whites of the eye and there's almost a translucent or clear tissue. That's called the conjunctiva. And believe it or not, if you put fluid there, it can live under there. And that's called a bleb. It looks like a blister. It's a little collection of fluid between the white sclera and the clear conjunctiva. And that's what we refer to as a bleb.
And is that something that patients can see? Is it like visible to others?
Yeah, the good news is it's not really visible to others unless you really look for it. Traditionally, when we make a bleb, our goal is for it to be hidden under the eyelid. And there are a lot of good reasons for that. One, because, you certainly don't want someone looking at your eye funny, thinking that you have a little blister or something there. But two, it becomes protective. The eyelid becomes protective of that collection of fluid and helps protect it from bad things happening, like trauma from any debris, like dust or particles. Also protects it from any bacteria from getting in and causing an infection there. So unless you lift someone's eyelid up that's had a bleb, you really shouldn't be able to see it. Now, sometimes people heal in ways that we can't really control, and the bleb may kind of travel below the eyelid, in which case it might be a little bit more noticeable. But generally, it's not very noticeable to another person looking at you.
I did want to mention that of the subconjunctival surgeries, so we've mentioned the trabeculectomy, the XEN stent. There's also something called a PreserFlow. We are not doing that in the United States currently. If you wanted that surgery, it would take place in another country like Canada. But in terms of, again, these subconjunctival surgeries, Dr. Garg, do you feel like the XEN stent, is it a replacement for trabeculectomy, or how do you use that as compared to a trabeculectomy surgery?
Yeah, that's a great question. And I think there's, a lot of discussion amongst glaucoma specialists about that. I think the truth is that the XEN is really not a replacement for trabeculectomy. I think trabeculectomy remains as the gold standard glaucoma surgery. But what I do think that XEN can offer is a way to lower the pressure to a larger degree than other minimally invasive techniques and allow the fluid to flow out of the eye without putting a larger hole and without taking some of the risks that may come with a trabeculectomy. Ultimately, if your glaucoma is advanced or if you need a super low pressure, I think the trabeculectomy is still going to be the answer. But sometimes, because of lifestyle considerations or other things going on in a patient's eye, they may not be the ideal candidate for a trabeculectomy. And I think that's where a XEN stent can come into play. Particularly, I found, younger patients who don't want to take time to recover. With a trabeculectomy, you really need a good few weeks of light activity to recover to allow the eye to heal. And a lot of times that can stop someone from pursuing a surgery that they really need to protect their vision. And a XEN stent, it provides a little bit more stability and a little bit of a quicker recovery. So for those people, it might be a good option to think about and maybe prevent them from having a trabeculectomy, or maybe delay them from having a trabeculectomy so it can kind of fit in within their lifestyle.
So you can do a XEN stent and a trabeculectomy or one of the other glaucoma surgeries later on if needed.
Absolutely. One thing I tell my patients is that, glaucoma is a marathon. And we're always, as glaucoma specialists, not just thinking about what we're going to do today, but we're also planning ahead, thinking that, in 7 to 10 years, when this surgery isn't working, what's the next thing we're going to do? And so until we find a cure for glaucoma, I think that's always going to be the case, that even when you do one surgery, you're thinking about something else potentially down the line. And the good news is with the XEN, it doesn't stop you from getting another one of those surgeries in the future.
Something that I tell patients when we're considering trabeculectomy versus a XEN is that with a trabeculectomy, if you're a contact lens wearer or you're really into swimming, I don't really recommend you do a trabeculectomy. But the nice thing about the XEN is that it can be done in people who wear contact lenses. And I don't know if you mentioned this to patients also, but in terms of the swimming, I'm more comfortable with patients if they're like avid swimmers, if they have the XEN stent.
Yes, definitely. That's part of the conversation in terms of lifestyle. I think swimming, contact lens use, I would agree with the same thing. Contact lenses, while they're certainly helpful for correcting vision, they can be a nidus for infection. They can just carry a lot of bacteria. So I agree with a trabeculectomy, I'd be really scared for my patient to wear a contact lens. But I think because the XEN, it's a much smaller hole, and there's some protection there because there's not a large entry point into the eye. I think it's a little bit safer. I also think about XEN in patients who are maybe bodybuilders, who lift heavy weights, and who are very much into working out and have that kind of lifestyle. I really worry about heavy lifting with trabeculectomy patients long term, and I think XEN can provide a little more stability for those patients as well.
You did mention that the recovery is quicker with a XEN. Can you just tell the audience members what patients can expect with the recovery?
Definitely. So what I tell my patients when we're thinking about doing a XEN stent is I tell them that you're looking at probably about a month of kind of up and down in terms of the eye pressure. But usually, I think the things that patients care the most about is their vision. They want visual recovery pretty fast. They want to get to seeing and get to their daily activities. So I tell them usually within a week, they should be seeing a lot better. After that, in the first month, the pressure can be up and down a little bit. Usually in the first week, the pressure is quite low with a XEN stent. Sometimes I even say that if your pressure is not 6 or lower, then we got to think about, maybe the XEN isn't working, or maybe something's not positioned appropriately for the stent. And then usually at about a month, things start to stabilize, and I release my patients back to full activity, full physical activity, full work activity. And so that's a little of a quicker recovery than I would for my trabeculectomy patients, which I might hold back for 6 or 8 weeks instead of a month.
What kinds of results are you seeing with the stent?
Yeah, I think the results are pretty good. Patients ask me all the time, what's the success rate? And for trabeculectomy, I'd say the success rate is probably somewhere in the 90s. For a XEN, I'd say probably somewhere between 80 to 90. So it's, not as high of a success rate, but it's still pretty successful. One of the things that, I think is important to remember with a XEN and with a trabeculectomy is that oftentimes we're going to have to do some postoperative adjustments. We might have to laser a suture for a trabeculectomy so that there are stitches that we put in to regulate the flow, and we might have to do a laser to open those stitches. And just like that with the XEN, sometimes there can be micro occlusions or tiny particles that clog up that little stent. And sometimes we have to laser that in the first month. Sometimes we also have to do what's called a needling. That's where we literally use a needle to open up some scar tissue that happens in that bleb that we talked about. And that can happen both with a trabeculectomy and with a XEN. And if you kind of keep in mind that these are normal things that can happen after the surgery that you have to do to tweak to keep it working, I think you can see that the success rate is actually pretty high for both procedures. One thing to, keep in mind for patients is that having or needing these tweaks is not necessarily a bad thing. We are basically trying to fight the body's natural urge to heal, to close this surgery that we've done. And that's difficult, especially with younger, healthy patients or even older patients that are healthier and living longer. They have great immune systems that want to scar up. And while that's great for other uses in the body, that's what we're fighting in glaucoma.
And for the audience members maybe who are thinking about getting one of these stents or know someone who has been offered a stent, can you offer any advice?
Yeah, absolutely. I think, the biggest thing to think about if you're considering any kind of filtration surgery, but particularly XEN stent, I think is just to talk to the surgeon about, what your individual concerns are, what your expectations are for the recovery period, for your lifestyle. I think being really upfront with your surgeon and mentioning things like, for example, if you're an avid swimmer, that hopefully would be a question that your doctor asks. But if it isn't, please volunteer that information, upfront. It may be helpful to the surgeon to decide what kind of procedure they're gonna do. Ultimately, our goal is to not just lower your pressure and keep you seeing, but also to find the right fit for your lifestyle so that it doesn't slow you down or derail you from the things that you love to do.
This has actually been a great conversation because there's not a lot of information out there about these newer procedures. And we get asked a lot, but frankly, we just don't have as much in terms of data or discussions that's available to patients. And so, Dr. Garg, just wanted to ask, how can patients make appointments with you and how can we support the work that you do?
Yeah, thank you. No, you can call my office. I'm located in Rockville. My practice is called Visionary Eye Doctors. We have an Instagram, we have a Facebook, we have a YouTube. Reach out to us on our website. There's a link to make an appointment. I'd love to help out anyone that needs the help.
Thank you so much for joining us. Do you have any last words or anything for our audience?
No, I'm just thankful to be here. And I love the podcast. I refer a lot of patients to this podcast. I think it provides a lot of great information. So please keep this work up.
Thank you so much, Dr. Garg, and have a great day.
Thank you.
Thank you for joining us. Until next time, your mom says take your drops.